So for my previous SWOT, I decided to, again, narrow it down just a little bit. It is very similar, but I wanted to narrow it down to education inclusive of patient and caregivers for cardiology patients, and specifically our low-risk chest pain patients. And when we are looking at our strengths, the ability to support low-risk chest pain patients through their educational goals, such as with medications, stress testing, and follow-ups, collaboration among patients, families, and the team to ensure that these goals are met with those follow-ups and testing, motivated caregivers and patients to improve their outcomes. By giving them this knowledge, they're able to address certain patient needs. Just kind of like knowing and understanding what their risk factors are, knowing and understanding what the difference is between, some of the symptoms that they're experiencing, when to call 911, when to go visit their nearest urgent care or emergency room. And then also the ability to reduce confusion, anxiety, and frustrations with the inability to manage plan of care. So without having the appropriate knowledge, patients and families can definitely feel frustrated and confused and angered by what's going on, and may even feel neglected to one point if they don't have proper direction. Some weaknesses include lack of patient and caregiver engagement in the plan of care, which is something we've already discussed, patient and caregiver confusion, anxiety, and frustration, limited collaboration amongst all parties, poor communication, the lack of standard educational guidelines for patient and caregiver education. So there's really nothing set in stone as far as kind of like a packet or discharge summary that goes home with the patient upon discharge. A lack of specific educational programs for caregivers regarding heart health. So I have seen that there are some external outpatient resources, but it's nothing that is like set for a patient to, let's say, have 5 sessions of educational programs lasting an hour each session for both patients and caregivers, giving them an opportunity to like answer and ask and answer questions. And then also the inability of patients and families to operate technology that could provide these educational resources to them, either because they're not familiar with the technology, they don't understand it, not just with mobile phones and cell phone and things like that, but also with patient portals and outside resources. Opportunities would be improving the relationship between the healthcare team, patient, and caregiver, decreasing readmissions. Patient and families are now engaged and active in care, and involvement with the community resources for educational opportunities. Threats would be poor patient outcomes with decreased accountability, gaps in service provided to the patient due to non-compliance as a result of the lack of education, increased healthcare costs because of obviously visits and readmissions, patients and caregivers feeling coerced, as mentioned, and the potential for receiving wrong information, and then of course the shortage of experts for training and education.